So the RESECT study is an international observational study with an embedded cluster randomized control trial about TURBT surgery for non-muscle invasive bladder cancer. The importance of this study is that we know that the quality of that first surgery that is done for non-muscle invasive bladder cancer, it serves two purposes. It's a diagnostic procedure that tells us grade and stage information about the tumour, and it's a therapeutic procedure that treats the tumour in a large proportion of patients. And that quality of that therapeutics has a significant impact on subsequent outcomes for the patient, both because of cancer recurrence due to residual tumour, and secondly, because of accuracy of staging and therefore application of the correct adjuvant treatments based on the correct diagnosis at the time of surgery. There is evidence that the quality of that surgery varies a lot across hospitals within the same country, and even more across the world, across countries. And that's for a number of reasons that have not been well studied to date. And that evidence that there is variation has so far been really based on surveys or anecdotal reports throughout countries and between countries about how the surgery is done differently and what the outcomes are. The first step of the RESECT study, and what I'll be presenting on at EAU, is to, for the first time, use patient-level data to prove that that variation exists, so that to prove that there's variation in the quality of how the surgery is done, in the application of an adjuvant chemotherapy or mitomycin or a single installation intravesical chemotherapy, and to show that that variation exists within the UK and internationally across the world. And with that first step established, we then aim to answer the question, why does the variation exist? And how big of an impact does that have on crucial patient outcomes like cancer recurrence and progression rates?